Hello and welcome to the Oakland County Megacast. I'm Tyler Keefe in the studios of our flagship stations, 89.3 Lakes FM and Civic Center TV. We're also on Birmingham Area Municipal Access, all of our TV channels, Comcast Channel 15, AT&T Channel 99. On the web, civiccentertv.com, and on Facebook via Facebook Live, Civic Center TV 15 and Lakes FM. And as always, joining me today from her home studio in Keego Harbor is Ronnie Dahl.
Hey, Tyler, I know we want to jump into the headlines because the governor's going to be speaking at 10:30, but I have to tell you, I had the coolest experience this morning.
What happened, Ronnie?
So I went out for a morning run. So I started training for the half marathon. Go out. First thing I do, you walk out 5 deer in the backyard.
Wow.
Really cool to look at, too, as long as they're munching on my neighbor's bushes and not mine. Just stay away from my hydrangea, warning now. But then I go out for the run, come back on the West Bloomfield Trail, and I did pass the one deer by itself a little ways down, kind of like just sauntering along. And then I come back, and I was like, well, is the deer going to move? You just going to hang out? Totally just, I mean, I was within a few feet of this deer. I pulled out my phone, recorded it, and it just looked at me like, hey, how's it going?
Yeah, just a friendly deer. Just a
right.
friendly deer sitting there being like, hey, I'm just going to do my thing. You go ahead and have fun on your shirt. Go ahead, take a picture, have fun, have at it.
And there was a cat right there. Wow. Didn't even care about the cat, nothing. But, Mother Nature is amazing. Although even my husband was saying, maybe they're starting to get a little bit too close.
Maybe they are.
Friendly.
Maybe they are, but they're coming by to say thank you for all the flowers that they're able to eat in your yard, right?
Well, I don't have any as of yet, so we'll be getting them. But yeah, so it's such a cool experience.
It is.
I mean, it's just the little things in life, Tyler.
It really is, Ronnie.
Hey, so with that too, as you know, last night I went to the Tigers game. Mm-hmm. Interesting experience. Okay. Let's put aside for the fact that they're really not any good. Do you plan on going to any games this season?
I might go a little bit later on in the season as things start to open back up, and my friends and my family have been vaccinated, and through that 2-week period after their second shot, they get the 2-shot vaccine. I may consider it. I don't have any plans as of now. If something comes up and there's an opportunity, sure, I wouldn't mind going to a game, but I'm not exactly clamoring for it because, as you said, the team is about as good as I am at baseball at this point.
I will say, if anyone is planning on going, not really hard to get really good seats right now because, as you know, they limit the capacity, and what they do is they basically close off certain seats. Mm-hmm. So you can only sit so many people in a group, and then they space them out throughout the ballpark. So it looks, I think, emptier than normal. But I am wondering, a few seasons ago in 2019, I remember there were times looking at the at the crowd shots, and it was like a ghost town. Yeah,
when these teams are not very good, the fans in Detroit don't really care to show up. They'd rather stay at home and watch the game at home, especially now during a pandemic with lower capacity limits as well. Why go to the ball game when we can watch a terrible team play terrible baseball from home instead in the middle of a pandemic? So these teams, that's one of the many incentives to get your team playing better ball and improving and winning games, is to get fans back in the stands so that you don't have to give away tickets like the Tigers basically have to do this season.
So just for anyone planning to go this year, basically what you have to do is you pull out your cell phone. There's like a QR code. Mm-hmm. You scan it. You have to do like an online survey, a health survey. Do you have symptoms? Have you been around anyone? This, that, and the other. And then after that, you can go into the ballpark. They take your temperature. Although I always kind of laugh when they take your temperature and you're having to stand outside in the cold, because it was only 40s or 50s last night, but still, they're doing their part. But just let people know that that's going to be a part of the process, because really the assumption is that everyone has a cell phone. Right. And while a good portion of people do, but we do know a lot of senior citizens still don't, or they have those flip phones when they can find them. Hey, with that, the White House has announced, Tyler, new efforts to try to vaccinate Americans, including an expansion of the free rides from Uber and Lyft to get shots, and a partnership with community colleges to try to get more vaccines in the arms of individuals. So Lyft and Uber is going to continue to offer free rides through July 4th to anyone going to get vaccinated. That's according to the White House. It's an expansion of programs that we're already providing to some low-income users in cooperation with pharmacies as well as some of the nonprofits. So not necessarily new, it's just being expanded. The Biden administration and its federal pharmacy partners also seeking to start on-site vaccination clinics at community colleges in a bid to try to inoculate the students, the staff, as well as those in nearby communities. The White House said it had selected community colleges because of the diversity of their student populations. Because as we know, the pool of people seeking to get an appointment to get a vaccine is all but exhausted right now. So the government is trying to shift its attention to those willing to take the shot, but basically they don't want to go out of their way to get it.
Yeah, and providing transportation for those that want to get the vaccine but don't have access to reliable transportation or have to go to different vaccination sites that maybe are too far away from them. These programs are extremely helpful, and that's why the expansion of them is so important right now, because there are a lot of people that still would like to get the vaccine but aren't able to arrange appointments that correspond with public transportation or with their friends and their family that may be able to provide them transportation to and from these sites at certain times. And with the expansion of these kinds of programs and with vaccination sites really relaxing the scheduling of appointments to get vaccinated and having them be more open, that is more encouraging for people to be able to go out and get vaccinated on their own time at will, basically, at this point, and help us get through to that 70% threshold or higher that we need to be at to reach herd immunity.
Well, we know we're a community that likes convenience.
Yes.
So, hey, one group, Tyler, a business group, is saying it's time to cancel that extra $300 in federal unemployment programs. As employers struggle to find workers, Michigan could make it easier by canceling the extra $300 in jobless benefits and getting rid of federal unemployment programs. That's according to a state business group. At least 4 states have already decided to stop accepting the federal unemployment benefits in mid to late June. They include Montana, South Carolina, North Dakota, and Iowa. Michigan should join them. That's according to the Michigan chapter of the National Federation of Independent Business. Nationwide, 44% of small business owners report having job openings they simply can't fill. And those numbers are expected to be even higher here in the state of Michigan. Of course, how it's working right now, Michigan currently offers up to $662 per week to unemployed workers, thanks to the extra $300 in benefits from the $1.9 trillion American Rescue Plan and the extra $300 in the federal unemployment programs. And they are not expected to expire until September. However, the Whitmer administration at this point says she doesn't think that's going to be happening.
And in this case, you see both sides of the argument. On the one hand, a lot of these businesses, many of them small businesses, but also many of them being large corporations or mega corporations across nationally or worldwide, are arguing that they can't get employees, and so it's suffering their business. Where on the other side, there are people that are collecting this unemployment that are either continuing to look for employment, but maybe not doing so as intently or as aggressively as they would be in normal times, because a lot of these jobs that may be open aren't offering wages that are either competitive to where they could get it in another place if they bide their time and wait a little bit, or are not paying them a wage that helps them cover their basic necessities in many cases. And so there's arguments on both sides of this coin here about why these unemployment benefits, especially during this pandemic, are so crucial, and why these unemployment benefits could potentially be detrimental to some of these businesses, particularly small businesses. So really, it's like anything else and any other issue we've been dealing with during this pandemic. You got to find some common ground that pays wages that are livable for people that are looking for work and are able to fill these jobs, but are not at the detriment of these businesses.
Hey, with that, Oakland County is going to be receiving over $650 million in the American Rescue Plan funding. Oakland County, its communities, and the K through 12 schools slated to receive about $656 million in the federal American Rescue Plan funding to help with the COVID-19 pandemic response efforts. U.S. Department of Treasury released the final guidance yesterday on how some of that money has to be used by state and local governments. So of the $1.9 trillion made available through the American Rescue Plan Act, just over $18 billion is available to Michigan through various federal revenue streams. That includes $6.5 billion in direct assistance for the state of Michigan, which is $800 million more than initially expected, and $1.93 billion for the state's counties, $2.4 billion for the state's local governments, $3.9 billion for Michigan's K through 12 schools. And local governments are going to be receiving the funding in two phases. About 50% of the allocation is going to be provided this month. The second half, the remaining balance, to be delivered in about 12 months. And of course, you can always find the latest headlines. Go to civiccentertv.com, click on coronavirus. And with that, we're going to jump to a quick break, get into the show just a little bit early because we know the governor is going to be speaking around 10:30, but we also want to bring in our good doctor, Dr. Taweel. He'll be joining us right after this quick break.
Wearing a mask is more than protection. It's a bridge to better days. The path back to celebrations with family. Nights out on the town with friends. Game days with your favorite sports teams. And the thrill of live concerts. But until we can all get the COVID-19 vaccine and build community immunity, which will take time, we all need to continue to stay careful. Because Michigan's recovery is depending on you, and so are your family, friends, and neighbors. So even after you're vaccinated, wear a mask, avoid large gatherings, and social distance. One day in the near future, we will all be able to put this pandemic behind us. But until then, spread hope, not COVID. Learn more at michigan.gov/coronavirus. A message from the Michigan Department of Health and Human Services.
In times like these, we have to believe in each other.
And we believe that you'll do the right thing.
When it comes to stopping the spread of COVID.
Follow the 3 W's.
Wear a mask.
Wash your hands. Watch your distance.
And when it's your turn to get the vaccine, take your shot.
It all comes down to the golden rule.
Treat others the way you want to be treated.
We're so close, Michigan.
We can do this together.
Quitting smoking can improve your health, but it also protects your loved ones from secondhand smoke. Did you know there's no risk-free level of exposure to secondhand smoke? Smoke from cigarettes, e-cigs, and hookah can travel through ventilation systems and harm those around you. So clear the air and stop secondhand smoke. Call the Michigan Tobacco Quit Line at 1-800-784-8669. A message from the Michigan Department of Health and Human Services.
Great to have you with us here on the Megacast. I'm Ronnie Dahl here in the home studios. Mr. Tyler Keefe holding things down for us back there in West Bloomfield. We want to go ahead and jump in with our first guest because we do know, obviously, over the past year, you've been such a great voice of reason and explanation for all of us and our audience because you are the medical professional, Dr. Jamie Taweel from the internal medicine specialist from the Grand River Medical Associates. And we always appreciate your view on all of the things that are going on. Are you surprised right now at the hesitancy of how many people seem to not want to get vaccinated?
Yes and no. I am because there's always going to be hesitancy. And even with the flu vaccine, there's always been hesitancy. Even with children's vaccines, there's always been hesitancy. But with this one, just given the rollout, I did expect a lot of it, but I just didn't expect it to the degree that it was. There's been a lot of people that have just been genuinely concerned about it, and rightfully so. Those concerns are real, and they should be addressed rather than just ignored. People have been kind of marginalizing people that have concerns about the vaccines. There's one thing where someone says, I get two types of people. Some people want to, I want to wait and see kind of how this works and see how people have been responding. And then there's other people that are just flat out no. So, you're going to expect some of it, but not that much,
But now, especially with the Pfizer, it is expected the CDC is going to come out probably tomorrow to approve, or later today, and then maybe as early as tomorrow, kids 12 to 15 years old will be able to get the Pfizer vaccine. Your thoughts on that? Because if we're seeing the hesitancy in adults, it'd be interesting to see if parents want to get their kids vaccinated.
Exactly. And I think since adults are going to be responsible for getting their children vaccinated, I expect those rates what's the word I'm looking for, the rates of people that are going to get vaccines will pretty much mirror children and adults, clearly. But I do think that there will be certainly more hesitancy just because, but they should also take into account the fact that it took a lot longer for children to be approved, which means there was a lot more research put in. I think people are still kind of stuck at the minute it was emergently approved by the FDA, that all research got halted, and that's just simply not the case. They had a lot more time to continue doing research. So hopefully they'll take that into consideration and get as educated as they can and make a decision that's best for them and their families.
So it's been a while since I've had to be vaccinated as a kid to go to school. But back when we were growing up, there were certain vaccinations you had to have, your mumps and various other things. So where does that stand now? Can parents opt out of getting their kids vaccinated if they want to go to public school?
I'm not quite sure about. So you can opt out of the vaccine, clearly. I mean, it's not FDA approved for general use, so therefore people can't be compelled for it. It's still considered, given the fact that it's emergency use, it's still considered an experimental drug, not necessarily, not by word, but by technicality, so to speak. From the best of my knowledge, the military still can't compel its members to take the vaccine, given the fact that it's not considered widely FDA approved. That being the case, you do have the ability to say no to the vaccine. You can't compel anyone to do it. Now, will private industries such as schools, private schools can certainly enact those types of things, saying, look, if you're not vaccinated, we're not going to take you. I'm not quite sure about public schools. I don't think that's possible yet, but please don't quote me on that.
Yeah, and I think that some schools have even changed their policies through the years as well with other vaccines that aren't COVID related.
Yeah, and it's definitely a sticky situation. I think you have to sign a bunch of waivers, and I'm not quite sure, and I don't want to speak on something I'm not 100% knowledgeable of, but I do know that there are people that are not going to get their children vaccinated. And mind you, this is 12 and above, so we're not talking elementary school, things like that. But in grade, middle, and high school, that can still be an issue for people, and unfortunately, that's going to be the case.
So do you anticipate that doctors' offices such as yours will start to receive the vaccine because, the supply has overreached the demand right now?
Hopefully, the Johnson & Johnson rep that I spoke with I'm trying to get to provide the vaccine for my office, has informed me that until it becomes FDA approved for general use rather than emergency use, it's limiting my ability to purchase it as it were a medication on the market. So that's kind of stymied me in my ability to provide the vaccine. And bigger corporations that have made deals with the government, such as Myers, CVS, pharmacies, hospitals, they are able to get the vaccine provided to them through that means for emergency use. So it's not quite for market yet. It's not for sale. People are receiving the vaccines for free, getting Uber rides for free. It's still going to be a little bit of time before I'm able to get it, and people are able to get it, and it can be something that's billed rather than given for free. But I don't even think that'll be the case. So.
I will say, I'm going to admit something here. I went down to the ballpark last night to the Tigers game, and I remembered, because last week I got my J&J shot at Ford Field, and I was like, oh, free parking. I was like, it's a block away, you know, and of course there's a sign, no baseball fans. I was like, yeah, whatever. My tax dollars are paying for this parking anyway.
Right.
And so then of course we cut through Ford Field and they're like, here for your second dose? Yeah. And then I had to like maneuver my way through Ford Field to try to get out and got lost. And
Nice work.
I will say it wasn't worth it. I probably should have just paid the $30 for parking.
So were you at the game? Was it, if you're at Ford Field, that's considered, you were outdoors, correct? Is that,
Yes.
were you allowed to not wear the mask given the circumstances?
Yeah, so when you're sitting down, most people didn't have their mask on when they were sitting down with their groups, but you're very spaced out. There were 6 in our group and we couldn't even all sit together. So people are very far apart. There were no lines like at the concession stands or the bathrooms. So I think people will feel safe going to a ball game right now. So with that too,
and still be able to do it.
Yeah, I know, right? Dr. Jamie Taweel with us here on the Megacast. He's the internal medicine specialist for the Grand River Medical Associates. And with that, we're starting to see some of the complications from some of the people that have had COVID, some of these long haulers that they're calling them. Although some people are also reporting once they're getting their vaccines, some of their conditions are improving. But if someone falls into this group, what can they do? Can they do anything to try to improve? Most of them, it's their lung capacity, I believe.
So I'm getting reports. I have patients that have had COVID that are getting long-term effects. A lot of people are reporting kind of a brain fog, like they're just not thinking clearly. They feel kind of like they're drunk. There's been some issues with vertigo. There's been some issues with just kind of, again, long-term critical thinking that's just been making them feel rather just drained. Other people, long-term effects of their lungs, coughing, difficulty breathing. We would image them up to see if they have anything going on in their lungs. Make sure it's not a cardiac issue, because difficulty breathing can also, your heart and your lungs are basically wrapped around each other. So you stress one, you end up stressing the other. So we got to make sure that their hearts are doing okay as well. And a lot of it's just symptom management. Support the heart, support the lungs, and do the best we can. And hopefully it'll continue to improve. Other people having long-term issues with their taste and sense of smell still being gone up to 6 months.
Wow.
So far. It's been pretty rough. People have been really experiencing this for quite some time. And hopefully it'll continue to improve. And hopefully, I hate to have to tell patients like, we just don't know if this is going to be your new normal or not. Hopefully it isn't, but, supportive care and, allowing them to breathe better, giving them medications to open up their lungs has been helping them. But yeah, it has been real. People have been having long-term effects, and it's unfortunate.
So I know that we talked about this around this time last year as well, but as we go into the summer months, but the summer season allergies as well, or the spring season allergies. If I say it one time, I say it 100 times. No, I do not have COVID. I have seasonal allergies. But how do people know the difference? I mean, by now we should, because we've been talking about this for a year, but a lot of people still never had COVID.
Yeah, very true. And that's the other thing, just a real quick touch base on that long-term effect. People that do have these long-term effects, I also have to make sure that it is COVID and not something different. I still have to work those things up to make sure that they're not presenting with a new problem that we're just kind of lumping into COVID. Allergies being the same thing. Now, to answer your question with regards to allergies, you kind of answered your own question. You said it yourself. Every year, these are my allergies. I deal with this. And if it's something that you deal with when you go outside, or you have those common things that you've been dealing with, runny nose, congestion, that cough, some shortness of breath, things like that, it's kind of you get it. But people that have COVID, it's irrespective of where you are, it's irrespective of how you're doing, you just feel miserable head to toe. Viruses tend to get COVID does impact people differently, but viruses are a whole body issue. So people feel fatigued. They get fevers. Allergies typically don't present with a fever. Allergies are, again, they're those things that you've been living with for quite some time, taking some allergy medications to improve your symptoms. And if they do, that's you kind of treatment and diagnosis at the same time. But COVID tends to be a little bit more aggressive. It's rather sudden. It hits you. It's something you haven't experienced to a degree before. And that's usually how you tell the difference. Most patients always tell me the one thing I hear all the time: I know my body. And so they know, and if it's their allergies or if it's something and they'll come in and they'll say, I know my body, and this is not what I experience usually, and something's different. So.
Dr. Jamie Taweel with us here on the Megacast. He's the internal medicine specialist for the Grand River Medical Associates. And just another minute or two here with you on the show. And so as we start to go into the summer season, the good thing is we do know that more and more people are going to be outdoors. Fingers crossed. We had a great summer that we did last year as well with such nice weather. But when the governor is talking about trying to reach that 70% herd immunity, there's still a lot of debate around these numbers and that terminology, herd immunity.
Okay. So what can I help?
I guess one of the questions is it real? Because for people who are going to states like Florida or Ohio, they were already open through, so much sooner than what we were here in Michigan. And they don't seem to have the same restrictions, and they didn't see the surge that we saw over the past couple of months. So what exactly is herd immunity, and how do you get there? Can you explain it from a medical standpoint?
So herd immunity is a degree of immunity in a significant portion of the population to such a degree that it's no longer spreading the virus. In other words, you get that 70% number. 70% of people are either vaccinated or have had COVID and have antibodies to it to a degree. And as a result, they're not spreading the virus as actively anymore. And it basically phases it out. There'll still be cases, but they will not be as aggressive. It won't shut things down. It won't overwhelm the hospitals. And the hope is that we will get to that at some point in time. That being said, it is a little bit odd that, Ohio and Florida have not seen those giant spikes that Michigan has. I think Michigan kind of was restricted to such a degree, personal opinion here, it's such restricted to such a degree that once things opened up, everybody kind of just went for it, you know what I mean? And saw the numbers in other states not rising as aggressively. And I think we, got that proverbial slap on the wrist. And I think people are starting to be more cautious as a result. And the hope is that we'll get there. I'm confident that we can, not quite sure that we will.
So with that too, Doctor, if I can ask you, watching what's going on in India is heartbreaking. And we're hearing so much about variants. Should we be concerned about variants taking over and basically wiping out all the work that we've done to get to this point?
So I believe, the new vaccines, the Pfizer, Johnson & Johnson's been pretty aggressive about their vaccine, has been shown to be very successful against two types of variants. Those are the ones that they've been studying so far. And I know that the Pfizer and Moderna have also been very effective in preventing, variants as well, which is a good thing. There will always be variants that kind of come up there. And I think as they come up, I believe that since we already have the vaccine pretty much made, we kind of know what we're doing at this point, they will be able to make booster shots that will accommodate for variants as well. That's the hope, and I'm confident that'll happen. So variants are going to be, and by the way, just to make note of it, that resurgence that we recently had in Michigan was also due to a variant that just was very aggressive, much more easily spread. So that being the case, the vaccine has been shown to be effective against that variant. So people have been doing a good job. And it is something to be concerned about, but I think we're no longer fighting this from, I described it at one point in time, it felt like we were working on a car while we were driving it down the freeway. I feel like we're a little bit ahead of the game at this point, and we're able to kind of predict things that are going to happen and get to it a little bit faster since we've already been in this for so long.
That's a really good analogy. I like that. Dr. Taweel with us here on the Megacast. Doctor, we always appreciate your time, and we appreciate you being able to join us a little bit early. And with that, before we say goodbye, anything else that you want to add that people should be, it should be on their radar going forward over the warmer months?
No, I want people to go out and enjoy themselves and just be cautious as possible. One thing I'm kind of noticing, I want to if I could just get on my TED Talk for a minute, is that I see a lot of people that have just been very aggressive with other people that are choosing to or not wear masks. And I find that to be counterproductive. And I don't feel that people are going to change other people's opinions. I think it's just frustrating people. And I always tell patients, if you see someone that's not wearing a mask and it bothers you, your best bet is to socially distance from them, not get in their face and be aggressive. I think if you're concerned about spreading a communicable disease, having a heated conversation, close to face is not going to really win your argument, and I think people should just be respectful of other people's decisions as best they can. If you feel that they're not making a decision that's best for the community, I understand that, but that's their decision to make, unfortunately. I see a lot of people have just been taking this really, really aggressively, and it's disheartening.
It really is. And I think adding to the confusion on that conversation too, the CDC guidelines about people who are vaccinated and the ones that aren't vaccinated, and vaccinated people can, be without a mask, and this type of group. And that kind of adds to the confusion, because then also, do you go up to someone, are you vaccinated? I must be asked that 100 times a day.
How do you know? And it becomes difficult. I just think it becomes a mess, and I understand that. And people that don't want to get a vaccine and don't want to wear a mask, I disagree with it. My office, if you don't wear a mask, you can't come in. That's just the bottom line. I think businesses are going to do their best to restrict that. I don't think it's the job of people to just, again, harass other people. I don't think we should be harassing each other during this time. Stress is high enough.
Right?
Hopefully the CDC will open things up a little bit more, and we'll hit that magical number, and we can just start living our lives. So.
Well, Dr. Taweel, we appreciate your time so much. We are going to try to go to the governor live. Hey, Tyler, do you want to take a quick break, or can we go straight to the governor?
We can go straight to the governor, Ronnie. She has already begun. We will actually just go straight to that video right now as we speak. Governor Whitmer already in progress live from Lansing.
The days are getting longer and warmer, and Seinfeld will be on Netflix sometime this summer. That is true, but it's just a little bit of levity. Life is looking and feeling increasingly normal. To date, Michigan has administered nearly 7.5 million doses of the safe, effective COVID-19 vaccinations. Over 55% of Michiganders have received their first shots, and over 40% are fully vaccinated, including 70% of our seniors. I also want to shout out to Leelanau County for being the first county in Michigan to hit 70%, and Oakland, Washtenaw, Emmett, and Grand Traverse for surpassing 60%. Nationwide, we have administered over 260 million doses. Nearly 60% of Americans 18 and up have gotten their first dose. On Monday, the FDA authorized the safe, effective Pfizer COVID vaccine, which is manufactured right here in Michigan, for children ages 12 to 15. And later today, the CDC's Advisory Committee on Immunization Practices will meet to review the FDA's authorization. This committee has the final sign-off before shots start going into arms, and this is great news. If and when the CDC committee signs off, and we expect that very soon, we'll begin administering vaccines to Michiganders 12 to 15 so that they can be safe from COVID-19 as well. We are ready to go in Michigan. We have Dr. Reddy here with us today, who will say more about this shortly. As a parent, I encourage all parents with children in this group to have a conversation with your family doctor about the safe, effective vaccines as soon as possible. As the number of Michiganders getting vaccinated increases, our COVID numbers decrease. After cases ticked up in April, I encouraged all of us to double down on basic health protocols we know work. Nearly 2 weeks into May, we have bent the curve. Cases are down more than 60%, and hospitalizations have fallen over 30% since our mid-April peak. Tragically, we've lost over 18,000 Michiganders to this virus, and we can't forget that. While we are making steady progress, we know that this virus is capable of when we let our guard down. I encourage folks to keep masking up indoors and always opt to be outside whenever possible. Thankfully, it's getting easier and easier to be outside as we enter the summer. And as the vaccinated population grows, we can take steps forward to continue lifting restrictions while keeping everyone safe. 2 weeks ago, I introduced the Michigan Back to Normal Challenge, which charts our path out of the pandemic. with specific metrics and accompanying actions. Our goal remains equitably vaccinating 70% of the 8 million Michiganders 16 and up, which is around 5.7 million people. So far, 4.5 million people, or over 55%, have gotten their first shot. There are 4 steps to get back to normal, and we hit step 1 on Monday. Under step 1, 2 weeks after we hit that 55% number of Michiganders 16 and up, we permit all workplaces to be allowed to return for in-person work. Michigan surpassed this 55% between Sunday and Monday at some point. So on Monday, May 24th, we anticipate that MIOSHA will take action allowing offices across Michigan to allow in-person work for all workers. Step 2 occurs 2 weeks after we get to 60% of Michiganders 16 and up with their first shots. What happens? Well, we lift the curfew on restaurant and bars. We'll increase capacity at exercise facilities and gyms, and increase indoor capacity limits at sports stadiums, conference centers, banquet halls, and funeral homes. We're slated to take further action as vaccinations continue climbing. Last Thursday, May 6th, MDHHS updated their COVID-19 gatherings and face masks epidemic order. Going forward, fully vaccinated people do not need to mask up anymore when gathered indoors at a residence. And outside the home, masks are only required at outdoor gatherings with more than 100 people. But I want to be clear. Masks are still an important tool to keep yourself and your family and the most vulnerable among us, especially indoors. That's how we keep people safe. And if you're not fully vaccinated, the CDC recommends you continue to mask up whenever you're around others who you don't live with. Masks are still required in stores, for contact sports, and indoors if you haven't been vaccinated yet, and are with people who aren't a part of your household. Every day, we're getting closer to putting this pandemic behind us. The way to get there is to vaccinate as many Michiganders who are eligible as quickly as possible. So if you've already gotten your shot, thank you for doing your part to keep yourself and your family and your community and the state of Michigan safe. I encourage you to share your experience with friends and family who've not yet made the decision to get their shots yet. Share your story because you are the best messenger for the people in your life. And now I want to speak directly to Michiganders who still have some questions or have not decided to get their shots yet. The vaccine is safe. It'll help protect you and your family and other people from getting COVID. Even if you have had COVID, you should still get vaccinated to protect yourself from variants or a repeat infection. If you received a monoclonal antibody treatment, you should get your shot 90 days after your treatment. The vaccine has gone through rigorous testing, and over 150 million Americans have taken it. The vaccine, like others before it for polio and smallpox, is trusted by doctors. Vaccines are our best chance of putting this pandemic behind us and returning to normal. They represent hope and healing. And if you want to learn more, I encourage you to talk to your family doctor and learn more about how the safe, effective vaccines can save your life and the lives of those you love. I got my second shot 13 days ago, meaning I can enjoy the benefits of an effective level of immunity starting tomorrow, and I'm really excited. I can't wait to see my friends who have not been able to hang out with in a long time. If you get vaccinated, we can all get back to doing the things we love with the people we love. We can have the quintessential Michigan summer we all crave. So thank you for doing your part. Now I want to turn it over to Dr. J.
Good morning, and thank you, Governor. So I'm pleased with the progress that we are making towards ending this pandemic. All of the metrics we are tracking for COVID-19 are decreasing, although the virus is still very present across the entire state. As of yesterday, Michigan has 253 cases per million people, and that number has been decreasing for 4 weeks. That's down almost a third from where it was a week ago. The percent of tests that are positive is 9.8%, almost half of where we were at our peak in the beginning of April. 11.8% of hospital beds are being used for COVID-19 patients, and our hospitalizations are continuing to decline. As these metrics trend down, the number of vaccinated people continues to trend up. I'm so excited that we were able to meet our first milestone in the My Vac to Normal plan this week, with over 55% of Michiganders over the age of 16 receiving at least one dose of the safe and effective vaccines. Because of this, MyOSHA will be able to start allowing businesses to bring their employees back to work soon. As the governor mentioned, about 7.5 million doses of the COVID vaccines have been administered across the state. About 60% of Michiganders over the age of 50 are fully vaccinated. That is just great progress. And this week, the Pfizer vaccine was authorized by the FDA for children aged 12 to 15 years. Now, as a parent of 2 children in this age group, I am thrilled. While we are still awaiting further guidance today from the CDC's Advisory Committee on Immunization Practices, the authorization of this vaccine is an important milestone for our children. This will mean less missed school because of quarantine, fewer missed sports practices and games, a return to birthday parties, sleepovers, and most importantly, our kids will have a much lower risk of getting ill from this terrible virus. Kids are not immune to COVID-19. We've seen many outbreaks among schools and school sports. And over 150 children in Michigan have gotten a very serious inflammatory syndrome from COVID-19 called MIS-C. And unfortunately, many of these children have ended up in the intensive care unit, and some have even lost their lives. So I'm asking all parents today to take this virus seriously and take your child to get vaccinated. Think about it, not having to wear masks, not needing to quarantine if exposed to the virus. This is really a big deal. We also want to ensure broad access to vaccine in trusted places. That means individual doctor's office, pediatricians, family physicians, school clinics, federally qualified health centers, and pharmacies. So today, I'm asking every primary care doctor to enroll as a vaccine provider. The most important thing we can do right now is to make vaccines available for whenever someone is ready. We know that patients trust their doctors, and when they are ready to get vaccinated, we want you to have vaccine on hand. Reach out to your patients now and ask them if they have been vaccinated and if they have any questions that you can answer about the vaccines. Primary care providers can also work with your local health department if you would like to keep smaller quantities of the vaccine on hand. Know that if you become a vaccine provider, you can also focus on just vaccinating the patients who you already know who are already in your practice. We at MDHHS want to make the process as simple as possible for doctors, and in doing so, make vaccines accessible to everyone. Now, we also know that everyone does not have a primary care doctor, so we are still focusing on our neighborhood, mobile, and homebound vaccination strategies, bringing vaccines to where people are. So we are making great progress. Vaccines are widely available, and our numbers for COVID-19 are trending down. We are in a new phase of fighting this virus, but this is certainly not over. We still have the virus very present across the entire state. We still have the threat of more easily transmitted variants that we are identifying every week and threaten to undo our progress. So for now, I'm calling on everyone to do what we know works to keep our numbers trending down. Remember that outdoors is much safer than indoors. Be sure to wear a mask if you are in public and will be within 6 feet of people who are not vaccinated. We also still want you to get tested if you have symptoms or if you are not yet vaccinated and have been exposed to someone with COVID-19. And please, do not delay getting your vaccine so that you can have the peace of mind of knowing that you and your loved ones are protected. So we are making great progress, Michigan, so let's just keep on going. And with that, I will turn it over to Dr. Reddy.
Thank you, Dr. J. Good morning. My name is Dr. Srikar Reddy, and I proudly serve as the President-elect of the Michigan Academy of Family Physicians. I'm a family physician affiliated with Ascension Medical Group in South Lyon, and I'm a virtual care and telehealth physician leader. It's been a long year going through the public health crisis, and family physicians have been working hard to help our patients and their families fight and prevent COVID-19. The progress made so far on vaccinations in our state is encouraging, but we still have a ways to go to protect all of our residents, including teens. Now that over 55% of the state's adult population is vaccinated, it's time that we shift our focus to individuals who are still hesitant. You may be thinking, I and a family member have had COVID. Why do we need to get vaccinated? It's important for everyone, including those who have suffered through the illness, to get vaccinated to help protect our fellow citizens who are at high risk of contracting COVID or who have an underlying condition that, were they to get the virus, could be severely ill or even die. I believe that getting vaccinated is our civic duty, and one that I take very seriously as a family physician and as a father, husband, and son. While hospitalizations due to severe illness and deaths from COVID are on the decline, Michiganders are still contracting and passing on the COVID virus. Getting vaccinated will stop this. Now is also time to focus to vaccinating 12 to 15-year-olds, especially as summer activities are on the horizon. Despite teens not being a high-risk population, the aim of vaccinating them is to control this highly contagious virus and prevent new variants from emerging. My 13-year-old son contracted COVID last December, and I will still be getting him vaccinated as soon as possible. My wife, who is also a physician, and I both trust in scientific trials that have proven that COVID vaccines are safe and effective, not only for adults, but also for our children. Speaking on behalf of my family physician colleagues, we understand there is still need to build confidence in the COVID vaccines, and we want to assure Michiganders that all of the approved COVID vaccines are safe and highly effective. If you have any questions about the vaccine, talk to your family physician, who can provide you with science-backed information. Family physicians are trusted sources for getting vaccinated and sharing evidence-based vaccine information. So with the help of family docs, the state's capacity to vaccinate adults and teens will grow, helping us end this pandemic faster. We know our patients. We know their history. We know their risk factors. It only makes sense to visit your family physician to get vaccinated and to get your teenager vaccinated too. A recent survey found that 8 out of 10 people rely on the advice of their primary care physician when deciding to get a vaccine. We're entering yet another new phase of the pandemic, and there is light at the end of the tunnel. Michigan's family physicians are key partners in helping end this pandemic and serving our patients at the same time. Lastly, outside of COVID-19, I want to remind Michigan residents to continue to stay up to date on other vaccinations, which are essential to public health in our state, such as those that prevent whooping cough, pneumonia, and measles. That goes for teens and children. Thank you.
Thank you, Governor. I appreciate the opportunity to be here today to address the importance of vaccination. I'm John Walsh, President and CEO of the Michigan Manufacturers Association. I'd also like to give a very hearty thanks to those of you who have been vaccinated, helping us all reach a huge milestone, that being 55% of our population receiving at least one shot of the vaccine. Our manufacturing industry has continued to work safely and productively since last May, following a 2-month pause. And while folks on the shop floor have been on site that entire time, members of our finance, engineering, and sales staff, just to name a few, can only now return to the office and join their production colleagues on site. This is clearly an indication of our progress in the fight against the pandemic and allows our office colleagues the opportunity to once again interact in person, increasing the effectiveness of collaboration, fueling creativity, and restoring those important social and professional relationships at work. In our opinion, the clear path to normalcy is through vaccination. And I'm proud to stand here today representing manufacturers across the state that have risen to the challenge from the beginning of the pandemic to respond to people's needs. In particular, I'd be remiss if I didn't recognize that one of our members, Pfizer, manufactures one of the most effective vaccines right here in Michigan. Our fellow Michiganians are working hard to protect their families at Pfizer and their friends, our state, and in fact, the entire world. What was once the arsenal of democracy is now the arsenal of health care, and we are very proud of our members and their contributions to keeping people safe across the country and the world during the pandemic. We will continue to encourage our members, their employees, and all of you to consider getting vaccinated. Supplies are now abundant and readily available, increasingly on a walk-in basis. Consult your doctor or members in the medical profession if you have questions and concerns. They are ready, and in my opinion, they are the most qualified to help you with making this important decision. One point that I do want to make is of critical importance to manufacturing as we continue to grow and recover from the pandemic is the need to get production workers on site. And one of the biggest challenges, of course, is childcare. Parents need to be confident that their children can return to school. Our board of trustees at the local level, our teachers, they need to be confident in the school system to get folks back, our children, into the classroom in the fall so that workers, well, let me start here, make sure our kids are safe and being educated, and then in turn, their parents can return to the workforce. So it's another additional reason why we encourage vaccination. We have hit the milestone of 55% laid out by the governor, and now we encourage others to move forward so that we can make progress in getting back to normal. To see each other at a restaurant, to cheer the Lions at a victory in a packed stadium, and to share the joy of those about you at a large and hopefully loud wedding. My thanks again to the governor for supporting the manufacturing industry and having me here today.
Thanks, John. Thank you, Dr. Reddy. Thank you, John. John and I served in the legislature at the same time. He served on the Republican side of the aisle. I served on the Democratic side of the aisle. I say Michigander, he says Michiganian, but we're all in this together to get the people of our state vaccinated. We've got to get the politics out of this moment and really appreciate the leadership that we have at our health systems across the state, at our manufacturers and biggest employers. We're all in this together, so I appreciate them joining us today. And with that, I'm happy to open it up for a few questions. So let's see, we got Rick Albin at the top of the list.
Governor, thank you for taking my question. The promise of vaccines is that at some point we get, as you say, back to normal. And that would mean for many of us not only being able to get back to work fully, the remote aspect would be gone, but so would be wearing masks, for example, when we're in our workplaces. At the very same time that's the promise, MIOSHA is proposing rules that could keep those same policies available if they decided to use them, wearing masks and disinfection, that kind of thing. Why is it necessary for another agency to take on that responsibility when Health and Human Services has been handling it during this period of time?
Well, MIOSHA is focused on workplace safety. That is their role. They've been working very closely with DHHS and big employers as well as labor leaders. We want to make sure that we get this right. We're also anticipating some further clarification from OSHA, the federal agency, and these, I think, are important aspects to us re-engaging in the workplace and doing so in a sustainable way that is safe and doesn't contribute to spread. And that's the ultimate goal here. I've had a lot of conversations with employers across the state, and I know many are encouraging their workforce to get vaccinated. Some are incentivizing it. We, of course, are encouraging state employees to get vaccinated as well, and working through if there are ways that we can encourage that. That makes sense. And so we appreciate the leadership that we're seeing across the state. We know that we're really encouraging MIOSHA to get some more clarity, and we're waiting on OSHA at the federal level, but it's really important that we work with our public health experts and work with our employers and make sure that our workforce has confidence. I know there's been a lot of talk about getting people back to work. People I know are struggling with a number of issues. One is confidence they're going to be safe when they get back in the workplace, and that's why it's critical we get this right. Another is childcare, and I am glad that I was joined by the head of the manufacturers here in Michigan. I think we all understand that childcare is a critical component toward getting people back in the workforce, getting working parents back in the workforce, knowing that they've got a safe, great place for their child to be when they are at work. And that's why I introduced $370 million in the budget to do just that. I am hopeful that the legislature will join me in this effort, because our goal is to get people back to work and take care of the youngest Michiganders there are. Dave Eggert.
Thanks, Governor. Several business groups in the Republican-led Michigan House want to use federal COVID-19 relief money to pay unemployed workers an incentive of up to $1,000 or $2,000 to go back to work. They're citing labor shortages. Do you support this concept, and would you sign such a return to work incentive if it got to your desk?
So when you think about the American Rescue Plan and the billions that were sent to Michigan under the Trump administration, then billions that are coming under the Biden administration, we have an incredible opportunity here. And this opportunity is reliant on us getting this right and being strategic about how we deploy those resources so that we can get people back to work, so we can get people enhanced skill sets so that they can get into better paying jobs, so we can wrap our kids with the kind of supports they need to address their academic needs, their mental health needs, their physical needs. All of these are important components to our mutual long-term success. So I've seen some of the conversations that are happening. We know that there are a lot of pressure points on working families right now in terms of getting back into the workforce. One is a concern that they're going to be safe, that their health is protected, and that's why vaccinations are so important. Another is childcare, and that's why we have made this a huge priority in my budget. And I think this would be a great first step for us to take together if the legislature appreciates how serious this component is to our ultimate goal of getting our economy back on track. I'd love to find some common ground with them on that particular item, because I think that would do a lot more to give parents peace of mind, and so they go back to work. Rachel Just.
Yeah, hi, Governor Whitmer. Thank you for taking my question. Today, the Michigan GOP is holding a press conference to talk once again about your trip to Florida. Now, I know you've said that you don't want to talk about that anymore out of concern for your own safety, but could you just expand on why you're not able to talk about a trip that was taken about a month and a half ago? And can you talk about claims that you used a private plane funded by Detroit businessmen to take that trip?
So I appreciate the question, Rachel. I'm going to make a couple of important points. Number one, when I ran for governor, I talked about all the different hats that I wear, that so many people wear, just like me, mostly women, frankly. The hat of taking care of my mom at the end of her life, rearing my daughter at the beginning of hers, also serving as a state representative and having to fight to make sure that my mom had what she needed at the end of her life. This is a part of my story. And so for anyone to be surprised that I had a family member who's been having a lot of health issues, that I showed up to check in, I don't think they're obviously not paying attention to who I am and what I do. It's been a centerpiece of the work that I've done as governor to take care and protect the people of Michigan. Now, I took a brief trip from a Friday to a Monday, 2 full days I was there. It was not a vacation, and it was not a gift. This was a quick trip that I took, and I think it's important for people to know, like a lot of children of parents who have health issues or relatives who have health issues, I showed up when I was needed. I did a lot of cooking, a lot of cleaning. I also did my day job, meaning I was on regular calls and conferences with my team. I didn't miss any of that work as well. When you're the governor of Michigan, you're always on the clock, but it doesn't mean that you're not also a daughter who shows up when a family member needs her. And this flight was not a gift. This flight was not paid for at taxpayer expense, and it was, I don't know that there's anything more to add. When a family member of mine needs a little help, though, I'm going to show up. Just like when we have a crisis here, we're going to work 24/7 to keep the people of this state safe. No more, we're done? Okay, all right. Thank you, everybody. Stay safe, mask up, but make sure you get those vaccines. We are making big progress, and it's time to feel optimistic. Let's all be in this together and get through it together. Thank you.
Governor Whitmer live from Lansing, addressing the state on the latest on the COVID-19 pandemic. From Lansing, live here on the Oakland County Megacast. You're listening to us on 89.3 WBLD Orchard Lake and 88.1 WBFH Bloomfield Hills. We're going to take a quick break here on the Megacast. And when we come back, got a lot of great interviews coming at you in the second hour of the program. This is the Oakland County Megacast on Civic Center TV, 89.3 Lakes FM, Birmingham Area Municipal Access, and 88.1 The Biff.
I want to get back to seeing my grandbabies every Sunday and smothering them with big hugs and kisses.
I want to get back to football games with my boys.
I want to get back to feeling and touching, connecting with the people around me.
I want to get back to family dinners and my grandma's mac and cheese.
I want to get back to real grocery shopping, taking my time, walking down every aisle, smelling the tomatoes and melons, having a free sample or two, or 3.
COVID-19 has changed how we live and how we feel. But now, there are vaccines. And they are the first step that let us get back to feeling optimistic about the days ahead of us. It's okay to have questions.
Is it safe?
Should I get it?
Should I wait?
Now, get the facts. Learn more at getvaccineanswers.org so you can make an informed decision when vaccines are available to you. Brought to you by the Ad Council.
Over a decade ago, the journey to a COVID vaccine began. Building upon research on other coronaviruses, scientists continued with months of research and development, 3 phases of clinical trials with tens of thousands of diverse volunteers, then peer review and authorization to deliver a safe and effective vaccine that will protect all of us. Discover the facts for yourself at michigan.gov/COVID vaccine.
We want to say welcome back to the Megacast. I'm Ronnie Dahl here in my home studios. Mr. Tyler Keefe holding things down for us back there in West Bloomfield. As a reminder, you can always catch us Monday through Friday, 10 a.m. until noon live. Civic Center TV, Birmingham Area Municipal Access. You'll also find us channel 15 on Comcast, 99 on AT&T, and you can listen to us on the radio, 89.3 Lakes FM, 88.1 FM The Biff. Or if that's not enough for you, you can also watch us on our social media Facebook page. So we make it easy for you. Again, just quickly, we can kind of recap Governor Whitmer doing an update for us as the state has reached the first milestone in her back to normal policy that she had set out for us. But I think what they're saying is things are improving here in the state of Michigan. We have 7.5 million doses have been administered here in the state of Michigan. 55% of those 16 and older have now had their first shot. 40% of Michiganders that are eligible are now fully vaccinated. That number jumps to 70% of the seniors. And here in Oakland County, Tyler, over 60% of residents here in Oakland County have now been vaccinated against COVID-19.
Yeah, definitely welcome news, and it's good to see that our vaccination efforts are starting to take a little stronger of an approach as we're going forward and getting those numbers up. We saw there's been a bit of a lull in the last several weeks as the demand for vaccines has kind of dwindled and the supply has continued to be there, and some more efforts are being made. We talked earlier on the show about expanded program from the White House in partnership with Uber and Lyft to help people get transportation to and from vaccine appointments. And then even today in this press conference, the chief medical executive of the Michigan Department of Health and Human Services, Dr. Jonae Caldoun, urged primary care providers and physicians to register to be providers of the vaccine to their patients as well, so that people can go to their primary care provider, ask those questions if they're a little bit hesitant or they have some curiosity about certain vaccines, and then potentially even get their shot from their primary care physician that they trust and that they go to regularly and get through the vaccination process.
Well, and that's going to be, I think, an important step in this conversation, because just before the press conference, we had on Dr. Taweel, and his office wasn't able to get it yet. So I think this new change by trying to get it to some of our primary care doctors is really going to be important, especially when it comes to getting 12 to 15-year-olds vaccinated.
Yeah, and I think it's going to be helpful as well in curbing some of that vaccine hesitancy, because when you're able to go to your primary care provider directly and you know that this person and they know you, they know your medical history, you can ask them questions about one vaccine versus another, about what they can expect after getting the first shot or after the second shot or from the single shot Johnson & Johnson. And that trust being there, I think, will help relieve a lot of people's hesitancy as well toward the vaccine for themselves and especially for their children 12 to 15, as that clearance from the Centers for Disease Control and Prevention is expected to follow up the earlier FDA emergency approval sometime later on this week.
One of the great things coming out of this, though, things are looking so much better here in the state of Michigan than what they did just a month ago when we were in the middle of really what was a third surge here in the state. So we are starting to improve in that area. Our hospitals aren't as overwhelmed. Cases are down about 60%. Since April. So we are moving in the right direction. And with that, we are going to continue to move forward in the direction here on the Megacast. And with that, we'll continue the second hour of the show, starting it off talking about golf. Let's bring in Nick Pumford. He is the head coach for the men's golf team at Oakland University. Coach, thank you for being with us.
Hey, thank you, Ronnie. We appreciate it.
So before we jump into the conversation, I do have to let you know, I'm not a golfer. I like putt-putt.
Hey, that works.
I will say my husband has become an avid golfer, so he's in a league on Tuesday. So, of course, he has to play on Monday to practice for the league on Tuesday.
Absolutely.
And then maybe even get 9 in before he goes to play on Tuesday because, of course, his score is going to get better.
He's got the golf bug, and it's funny, not that there's been a lot of positive from COVID, but the one positive is golf has really boomed in the state, well, in the whole world, actually. And so it seems like it's a kind of a safe thing that people can do, and they can get outside and get their exercise.
Well, with that, Tyler is really kind of our sports expert on the show, so I'll toss the interview over to him. That is, unless you want to talk putt-putt. I'm really good at getting the ball through the clown's mouth.
Hey, that's hard to do sometimes.
Tyler?
So one of the big things that came out of this season for Oakland University, of course, Oakland's got an increasingly growing sports program, athletics program over there in Rochester as well. And part of that is going into these larger leagues. A few years ago, of course, Oakland University moved into the Horizon League in many of its Division I sports, including in golf. And this year, actually, your team won the Horizon League Championship, the first in the school's history. Can you talk a little bit about what clicked this season that led to such a prolific outcome for the Oakland University men's golf team?
Yeah, I mean, it was an interesting season to say the least. Usually in college golf, we have a fall season and we compete in 4 to 5 events in the fall. And unfortunately, that portion was canceled. And so we had 5 events lined up for the spring season, in which we played 3. And then unfortunately, 2 of them got canceled because of COVID-related issues. So we actually, we didn't play a tournament for a month leading into the Horizon League Championships. And then on top of that, our number 3 guy was a close contact. So he was out for 14 days and couldn't compete for us. So there was a lot of unknowns going into the event, but all year we had shown promises during tournaments. And so most of our tournaments are 3 rounds. And it seemed like in every round or in every tournament, we'd have 1 round where we were the best scorer of the field. So the talent is there, and it was just believing. And the guys had a great couple weeks of practice leading up to it, and everything clicked.
We're joined by Thomas Giroux and head coach Nick Pumford from the Oakland University men's golf team here on the Oakland County Megacast. And it was really an amazing season for your team. 5 players in the top 16 in the Horizon League Championship. And part of the challenge of operating a sports team during this pandemic was all the start and the stop and the changes in regulations. How did your team navigate through that to be able to then still have this level of success and elevate that success to a championship?
Yeah, it's a credit to our athletic administration. They put some really nice protocols in place. We had tons of meetings to talk about what that looked like to keep the guys safe. And then ultimately it falls on the guys, right? Like every college student, right, their whole world was kind of flipped upside down, and it was a totally new experience. And we talk about culture all the time amongst our team, and guys being together and being around each other and just kind of creating a bond and team unity. Unfortunately, this year we couldn't do that. I mean, realistically, the only times that they were able to see each other was at practice, and at that they were socially distanced. And then it's not like they could go back and have lunch, dinner together, whatever. It was like they stayed in their little pods. And so we tried to socially distance as much as we could. We wore a mask all the time. But it's a credit to them, right? We didn't have any positive tests amongst our team the whole season, and they just followed the protocols and did what they were told to do.
We're joined by Thomas Giroux and Nick Pumford, the head coach of the Oakland University men's golf team. And Thomas, to go to you, you won Golfer of the Year this year in the Horizon League. And so for you as an athlete, as a player, going through this school year, which was completely different, and then going through the athletic season as well, it was also completely different. What was your strategy, or what was your approach to navigating not only the challenges on the links, but also your challenges in the classroom at Oakland University to be able to have a successful year?
The main thing was just focusing on the goal. Like every year, our goal is to win Horizon Leagues and move forward into the postseason, and staying focused on that, whether it was through cancellations of tournaments or just through regular practices. It's all about staying focused throughout the year and knowing what you need to do to move forward.
Thomas Giroux was the Golfer of the Year, of course, in the Horizon League, where the Oakland University men's golf team won their championship this year. And also Nick Pumford, the head coach of the men's golf team over at Oakland, won Coach of the Year. And part of the progress of growing a program at any university, and even at Oakland University, is taking those steps forward. It's building teams that are able to win matches. It's building teams that are able to consistently win matches. It's being competitive in your league tournaments and then competing for league championships and making it to the NCAA tournament. How has a year like this, Nick, helped propel your program and prepared your younger guys on the team, those underclassmen that are growing into the future leaders of this team, but also looking forward in recruiting and getting people to come to Oakland and know that they're going to a program that is growing, that is going places, and has a lot of success ahead of it?
Yeah, I mean, my philosophy from day one was to get as competitive as schedule as possible. So that was playing in events in the Big Ten, the ACC, traveling really all over the country to find the best events possible. And we attracted recruits that wanted to do that. And Thomas was one of those guys, and he blossomed. And so for us, if we're teaming it up next to Oklahoma State, Florida, that sort of thing, that's the highest level. And so we see what good is, and we try to measure ourselves to that. And so, like Thomas was saying, our ultimate goal is to win the Horizon League, but then really to compete on a national level. And so this is the first year in my 5 years that we're able to do that. And so we're headed to regionals next week down in Albuquerque, New Mexico. And you could argue that we have the toughest regional. There are 4 teams there ranked in the top 20 with the #1 overall seed, Oklahoma. So I'm cautiously optimistic, because if we played like we did a couple weeks ago, we have a really good chance of moving on to the national tournament. So, but guys are going to see what it is. We're going to see the Bearhead logo down there. Recruits are going to see that. Fans, alums, all of it. So it's a pretty exciting time for our program.
We're joined by Thomas Giroux, the golfer of the year on in the Horizon League with Oakland University's men's golf team, as well as Nick Pumford, the head coach of the men's golf team at Oakland University. A really prolific season for the Golden Grizzlies out on the links. Horizon League championship. Nick Pumford, coach of the year in the Horizon League. Thomas Giroux, golfer of the year. And they also had Yara Ilenko, who won freshman of the year. So this team is going places. And in terms of the tournament, you said that the regional is coming up. How does the tournament work in golf different than from other sports? Because we know in college football and in their playoff, it's head-to-head. Same thing within the NCAA men's tournament. But not a lot of people know how different sports and their tournaments work, with them being just as competitive as others.
Yeah, so there will be 14 teams there with select individuals as well. And then the top teams advance to the NCAA finals out of that event. And so there are 6 regional sites across the country. So there'll be 30 teams at the national championship. And then on top of that, the top individual on a non-qualifying team will also advance individually to the national championship. So, if our team doesn't play well, an individual could, and they could advance as well. So there's kind of a carrot at the end of the stick on both ends.
I know we're getting a lot further along in the vaccination process here in Michigan, definitely in Oakland County, and really across the country. How have the protocols been impacted as we are getting further along in this pandemic, and how does that affect how you practice and how you perform, Thomas and Nick, as we're going forward in this tournament?
Yeah, I mean, for us, we're fortunate that Oakland provided the vaccine to us. And so actually all of our guys are vaccinated. One of the protocols that we had to face all year was testing 72 hours before the first round of an event, so before we left, and then testing when we returned home. And so because everyone's vaccinated, the NCAA said that we won't have to test during the regional competition, which is just another thing not to have to worry about on top of everything else.
We're joined on the program today by Nick Pumford, the head coach of the Oakland University men's golf team, as well as Thomas Giroux, who was the golfer of the year in the Horizon League and is playing in the regional with the Oakland University men's golf team as well. And Thomas, as you're preparing for this level of competition, you're playing against the best of the best now. As your coach said, you were in probably the toughest regional, if not the toughest regional matchup in men's golf at the national level in the tournament. How are you as a leader on this team and other golfers that are participating in this regional from Oakland University preparing for such elevated competition and a chance to really put Oakland University men's golf on the map after having a successful NCAA tournament?
Well, we're focusing on the goal, and we're practicing hard. There's a lot of factors involved in playing in Albuquerque, like elevation and the wind. So the ball is going to be moving a little different than we're used to. So we're working on practicing with that and getting used to that. But if you want to beat the best, you got to practice like them and work just as hard as them. So that's what we're doing out here.
Nick Pumford with us, the head coach, and Thomas Giroux, a golfer from the Oakland University men's golf team here on the Oakland County Megacast. And Nick, we talked a little bit earlier, you and Ronnie touched on kind of the rise of golf locally here during the pandemic and really nationally during the pandemic as people were looking for safe hobbies to take on outside or new activities to learn outside as well. How has that sort of golf boom we've experienced over the last year or two impacted your program and where you may be going in the future as you continue to grow Oakland University men's golf?
Yeah, I mean, it's great to see. And so we're fortunate to have 2 great golf courses on campus. And I think in the month of August, they did 8,000 rounds last year, which was 2,000 more rounds than their record. And so, the guys are out here in their Oakland gear, have their Oakland bags, and it seems like people want to know what's going on. And so it's creating that sense of community, and we're lucky to be a part of it and to be able to talk about our program and inform people on college golf. And so we're seeing a lot more new faces, which is really cool to see.
Gentlemen, just another couple minutes with you before we let you go. Thomas Giroux and Nick Pumford from the Oakland University men's golf team. Anything else that we should know about your team as you're going into the regional or ways that the community can support our Golden Grizzlies golfers as they continue to compete in the NCAA tournament?
Yeah, so the cool thing is there'll be live scoring at the tournament. So if viewers go to golfstat.com, And then they pulled up the Albuquerque Regional. There'll be live scoring, and people can follow along as well. And, one other thing I want to say about the guys before we go, we also got a 3.49 team GPA, which was the highest in our program's history. And so, not only are they great players, but they're great students, and that's something that can't be overlooked.
Yet another great accomplishment from this season for the men's golf team over at Oakland University. Thomas, Nick, thank you very much for joining us today.
Thank you, Tyler. Thank you.
Appreciate it. We're going to take a quick break here on the Oakland County Megacast. A lot to get to as we go further on in the show. We talk so much over the course of this pandemic about the role of teachers in our community and how we've really learned how much more important they are than maybe we appreciated before. And that includes our student teachers. We got a really prolific student teacher also from Oakland University coming up next here on the Oakland County Megacast.
Quitting smoking can improve your health, but it also protects your loved ones from secondhand smoke. Did you know there's no risk-free level of exposure to secondhand smoke? Smoke from cigarettes, e-cigs, and hookah can travel through ventilation systems and harm those around you. So clear the air and stop secondhand smoke. Call the Michigan Tobacco Quit Line at 1-800-784-8669. A message from the Michigan Department of Health and Human Services.
Wearing a mask is more than protection. It's a bridge to better days. The path back to celebrations with family. Nights out on the town with friends. Game days with your favorite sports teams. And the thrill of live concerts. But until we can all get the COVID-19 vaccine and build community immunity, which will take time, we all need to continue to stay careful. Because Michigan's recovery is depending on you, and so are your family, friends, and neighbors. So even after you're vaccinated, wear a mask, avoid large gatherings, and social distance. One day in the near future, we will all be able to put this pandemic behind us. But until then, spread hope, not COVID. Learn more at michigan.gov/coronavirus. A message from the Michigan Department of Health and Human Services.
Finally, I just got my COVID-19 vaccine.
I registered with my local health department and they called me.
I got mine at the pharmacy and my neighbor got hers from the hospital.
I'm not a techie person, so I called the COVID hotline and they helped me schedule an appointment.
Get vaccinated with the first vaccine you can. Protect us all.
Learn more at michigan.gov/COVID vaccine.
We want to say thank you for taking time out of your day to be with us here on the Wednesday edition of the Megacast. Just to let you know, if for some reason you missed today's show or any of the previous ones, you can always watch the former episodes just by going to civiccentertv.com, click on the Megacast, or if you don't have time for the entire 2-hour show, we understand. You can also go to the on-demand section and just click on the individual interviews as well. So much we've been talking about here on the Megacast over the past year. It has been an extremely tough time for teachers to try to teach throughout the pandemic. And we do know, too, there's a teacher shortage. So many teachers right now are leaving the profession, but one local person is embracing education right now. Let's bring in Sarah Bussino. She is the winner for the Michigan Association of Teacher Educators Student Teacher of the Year Award. That's a huge accomplishment.
Thank you very much.
So why did you want to be a teacher?
Oh, geez. There are so many reasons. Growing up, I always just loved school. And I guess that's the first thing, is that growing up, I had a lot of great role models who were teachers who really inspired me. So the teachers that I had, and my dad's also a teacher, so that kind of helped. I saw people in the profession. And then just really the opportunity to help students grow. There's a moment when you teach, when a student finally gets something, when it clicks. That's just amazing. So that's really what inspired me to be a teacher.
So with that, Sarah, can I ask, what do you teach currently?
I'm currently teaching K-8 music and band at St. Regis Catholic School in Bloomfield Hills.
What has the past year been like for you?
It has been really crazy. So I started out in the fall student teaching virtually at a high school band program, which was very interesting, having to adapt to teaching online. And then just the switching during the pandemic of sometimes teaching in person and sometimes online has required a lot of adaptability and flexibility.
Especially when we're talking about band, because it's about the instrument and the music and the sounds that it makes. And we know everyone doesn't have the same technology. So I'm sure that it sounds a lot different through a computer screen.
And it's so difficult with band too, because band is really about the community, right? It's about the sounds that you make when you're playing with other people. So having to teach band when students are at home by themselves has been an additional challenge because you kind of lose a little bit of that community aspect, but we've been making it work.
But I'm also thinking starting as a student teacher virtually, because you're not getting, those moments of introducing yourself and, those words of wisdom. What's it been like?
Yeah, it was really difficult at first because you're right. A lot of things were different from what I expected. I started student teaching online in my basement. Like the first day I was like, this is very odd. I'm not in a school building. But finding ways to kind of build those moments in online was really the challenge of the year, whether it's like using a new website that the kids like, whether it's incorporating more like popular culture into the lessons so that you can connect with the students more. So it's been tough because we're losing those traditional aspects, but it's also an opportunity to bring in these new lesson ideas, which has been a nice challenge.
But with that too, I'm sure they appreciate having someone such as yourself, because we do know that some of us that are a bit older than you, we struggle more with technology than your generation.
Yeah, my mentor teacher was great, was very adept at using technology. So the kids are lucky to have him as a teacher too, but it's nice. I think because I'm a little younger, sometimes I can catch some of their like references to different internet things. So that's always helpful.
So with that, we're speaking with Sarah Bussino. She is the winner for the Michigan Association of Teacher Educators Student Teacher of the Year. So you are actually teaching full time now though?
Yes, yeah.
With that, what advice would you give to other people considering going into teaching, especially as someone who is new, starting out in the middle of the pandemic?
I would say just take every opportunity to learn as much as you can. Post-pandemic, when we can get back into classrooms, observe as many mentor teachers as you can. Ask to be a part of as many classroom situations as you can, because really, you can learn a lot through college and through your own education, but seeing the classroom activities daily and how it works is really where you're going to learn the most.
So tell us more about the award.
Yeah, so it was given by the Michigan Association for Teacher Educators, so basically the people in Michigan who teach the teachers, and it was given for a student teacher who showed exemplary like practice during student teaching and innovation. So so that was that. I was one of 2 winners in Michigan.
That is so awesome. What an accomplishment, because we do know too, it's a little bit more difficult, put the pandemic aside, to teach today, because so many kids are distracted. They have other things going on, social media. So you really have to find those ways to get their attention, but also get them engaged while teaching them at the same time.
That's absolutely correct. And that's something that I've really learned too in my lessons, is that you really do need to keep it fast paced to hold everyone's attention. That's, definitely right.
So what was the first day of student teaching like for you? Standing in front of the classroom can be a little intimidating, I would think.
The first day of student teaching It was pretty nerve-wracking. It was kind of weird again because we were virtual. It was in my basement, so I was all dressed up professionally with my fuzzy slippers on, sitting at my kitchen table. But let me think back. I just remember being nervous, but also very excited because I had met the students over the summer at their marching band activities, so I had already known some of them. So getting to see them in a different setting in the classroom, I was really excited to see what they had to bring to the table.
So you said that your father's an educator as well.
Yeah.
So you understand the industry, but what are your thoughts right now, knowing that so many teachers are leaving the industry right now?
Oh, yeah, it's a difficult time, especially starting out to be a teacher. I know that when I told some of my mentors that I wanted to be a teacher, people told me it's not a good time. You should look into something else. So I just really think that whatever you can do in your own way to support teachers, whether that's being involved in your child's education, if you're a parent, or supporting school districts. I don't know if people are in a place to do that financially, if they can. Just really showing teachers that you support them is a nice thing to do, no matter what time of climate we're in, really.
So I'm trying to think too, like if you're teaching band, these kids are at home and, parents in one room trying to work, and then you have maybe brothers and sisters in another, and then they break out the instruments.
Yeah, and that was a place where we really had to be flexible during our lessons and offer like extra time if students had to come play, because you're right. Some students were at home, their parents were working from home on Zoom calls. They had babies, siblings sleeping in the next room. They couldn't play during class. So we really had to be flexible and offer them extra time to come in and be able to complete their assignments. Yeah, for sure.
So as we go into the summer, but go into the fall, do you anticipate you'll be fully back into the classroom?
Yes. So at my school right now, we are fully back into the classroom with COVID precautions. So I'm very excited about that. And I hope that that can continue with the way things are going in Michigan.
So we're speaking with Sarah Bussino. She's the winner for the Michigan Association of Teacher Educators Student Teacher of the Year Awards. And what does your dad teach, by the way?
He teaches social studies at the high school level in Romeo.
So with that, too, when it comes to maybe some of your friends looking at going into teaching, because we do know that right now, substitute teaching is really a big area that they need so many people. You don't have to have a teaching degree to be a substitute teacher. Are some of your friends maybe looking at this profession because of what you've been able to do?
Yeah, I say that my friends are very supportive of one another. So whenever one of us does something like this, we take it as a point of inspiration. So I think it's been encouraging for people at Oakland and in my friend group to see me do well, because when they do well, we're all supportive, if that makes sense.
With that, Sarah, what did winning this award mean to you?
It was really an honor. And I was so glad that the Michigan ATE continued to give the award out this year, just because of COVID and everything that has happened, because I know I had to be so adaptable and flexible during my student teaching time. So it was just a great honor to have that be recognized through this award.
And with that, Sarah, when you have to do student teaching, how does that work? Do you have to have so many hours of student teaching, and do you teach under another professor or teacher?
Yeah, so it works a little differently depending on which university. At Oakland, we start with occasional student teaching. We call them field placements, 2 years into our degree. And we rotate through a few different mentor teachers until we find one who we really connect with. So I had a couple middle school field placements in elementary, and then I ended up at Cousino High School with Jason Rose. And I said, I think I would like to student teach here. And then that's when my full-time student teaching starts. So 5 days a week, you're there whenever the mentor teacher is there, learning as much as you can.
That's really a big commitment.
Yeah.
So with that, you're teaching music and band. You didn't mention the marching band. What's that like in COVID?
It's very interesting in COVID, as with many things. So marching band during COVID means we keep people as spaced out as we can. So that means our shows take up a little more space on the field than usual, just because we have more space. But marching band is fortunate because it is outside. So that's nice because COVID precautions are more relaxed. We know when people are outside. And it really looks different for each school district, but at Cousino, where I was, students were wearing masks when they weren't playing, making sure to be socially distanced. And it was a nice way because it was one of the activities during the summer that felt almost normal in the band world because we were outside and able to have practices and such. So it was a nice kind of normal thing for the students.
And it is good that you were able to practice in person, because I know that we've spoken recently with some people in the theater industry and trying to have to learn like dance moves or, moves via the internet and Zoom when the camera's reversed.
Oh, goodness. I didn't even think about that. Yeah.
So being able to practice in person, definitely a blessing in that regard. Sarah Bussino with us here on the Megacast. She's the winner of the Michigan Association of Teacher Educators. She won the Student Teacher of the Year award, but you are also now a teacher. Anything else maybe that we didn't ask you that you want to add before we say goodbye?
Just a thank you to everyone who has supported me along the way, especially everyone in the music department at Oakland University. They were the faculty and students that are really so supportive. And then to my parents as well, who are always an inspiration.
That's awesome. And Sarah, what instrument do you play?
I play the clarinet.
That's great. Well, thank you so much for being with us. We so appreciate it. And again, congratulations on the award and best of luck on your career as well.
Thank you so much.
Sarah Bussino with us here on the Megacast. She's a band teacher, but also a recent winner of the Student Teacher of the Year award. Congratulations to her. We're going to take a quick break here on the Megacast. And when we come back, we'll shift the conversation just a little bit, talking about business and the insurance industry right now. This is the Megacast.
COVID-19 has caused many families to fall behind on finances and on groceries. But you're not alone. You shouldn't have to worry about putting food on the table. MyBridges offers access to quality food and income assistance to help families across the state get the food support they need. It's easy to apply and easy to start shopping. Apply for services at michigan.gov/MIBridges. A message from the Michigan Department of Health and Human Services.
I want to get back to seeing my grandbabies every Sunday and smothering them with big hugs and kisses.
I want to get back to football games with my boys.
I want to get back to feeling and touching, connecting with the people around me.
I want to get back to family dinners and my grandma's mac and cheese.
I want to get back to real grocery shopping. Taking my time, walking down every aisle, smelling the tomatoes and melons, having a free sample or two, or 3.
COVID-19 has changed how we live and how we feel. But now, there are vaccines. And they are the first step that let us get back to feeling optimistic about the days ahead of us. It's okay to have questions.
Is it safe?
Should I get it?
Should I wait?
Now, get the facts. Learn more at getvaccineanswers.org so you can make an informed decision when vaccines are available to you. Brought to you by the Ad Council.
Great to have you with us here on the Megacast. Just about 20 minutes left here in the show. As a reminder, Tyler and I are here Monday through Friday, 10 a.m. until noon. You'll find us on Civic Center TV, Birmingham Area Municipal Access. If you have cable, channel 15 on Comcast, 99 on AT&T. And then you can listen to us on the radio if you're out driving around. 89.3 Lakes FM, 88.1 FM, The Biff. And if you are surfing the web right now, if you're sitting at work or, tired of a Zoom meeting right now, you can tune in also by just clicking on our Facebook page. With that, before we leave today, we're going to talk a little bit about insurance to bring us up to speed on some of the new laws and the changes here in the state of Michigan. Barb Sosin joins us. She's with Farmers Insurance in West Bloomfield. Barb, great to have you with us.
Thank you for having me.
I have to say, Farmers has some of the best insurance commercials ever. They are so creative, and I'm going to spare everyone from singing, the song at the end, but it just sticks in your mind.
Oh, that's a good logo, right? We want you to keep remembering that.
So with that too, Barb, though, we have to ask, this has been a crazy year for here in the state of Michigan. We have some of the highest insurance rates in the nation. Why is that?
Wow. Oh, it goes back.
You're like, we don't have a show long enough for that.
Yeah, we don't have a show long enough. That's right. So they're no fault state. So that has a lot to do with it. And a lot of the big expenses really had to do with unlimited PIP, or the personal injury protection. That is the medical aspect of our auto insurance. And so with the new law, what that did was it gave consumers the opportunity to now choose. If you have what the state of Michigan deems as qualified health insurance, then you do not have to have unlimited PIP. And so you can then lower your PIP options on your auto insurance. And so that was a big change. And so that, the medical costs are huge and very, very expensive.
And with that, Bart, how many of your clients did you see actually take advantage of maybe changing their insurance plan or really sitting down to understand it?
Well, we took the opportunity to call every single customer and go through what this new law meant, what the coverages mean, so that they are making an educated decision. And I have a very consultative approach to insurance because most people do not understand insurance. So I want to make sure that my customers understand what these coverages mean for them and their family, and they can choose what they want. Interestingly, not many of my customers changed their unlimited PIP because they see the value in having unlimited coverage. The people who had catastrophic accidents, they're the first to say, never go away from that unlimited PIP. Now, part of the new law did require that the insurance companies roll back their rates on their PIP. So even if you have unlimited PIP, you should have still seen, in most cases, some sort of a decrease in your policy, in your premium, I should say.
So with that as well, Barb, so many people are not driving the distances that they once did prior to the pandemic. Does your mileage impact your insurance? Should people be calling up if they anticipate they're going to remain remote?
For many carriers, it's making a difference in our rate, but it does not change policy at all. So our policies, a lot of them are going away from, how many miles do you drive in a day? Our policies haven't taken that into consideration for several years. Whether or not it's a commercial policy or you're using your vehicle for commercial purposes or business purposes is a little bit different. But in regards to, because you're driving less, unfortunately, we're not able to make any changes in regards to your coverages or your policy from that standpoint.
So with that, Barbara, if I can ask you, because I know we checked you before the show, but it sounds like your audio is kind of soft and going in and out. Is there something maybe covering the mic on your computer?
Oh, I'm sorry. I don't think so.
So right there, it's better.
Right now it's better? Okay.
Yes, that's good there. That's good there. We just want to make sure everyone is hearing you. So, so this is like a crazy time here in the state of Michigan, even for people when it comes to trying to get their driver's license renewed, or some of those Secretary of State issues such as tickets and maybe getting those cleared up. Have you seen some of your clients have challenges with the SOS, the Secretary of State's office during this time?
Yes, and it is a real challenge, especially for customers who want to change their insurance. We're having trouble running their motor vehicle reports because their driver's licenses haven't been renewed, but yet they can't get appointments at the Secretary of State. We've made some accommodations, and I think the carriers are trying to take that into consideration during these COVID times. One little trick that some of my customers have shared with me that have worked for them is they get on a list at the Secretary of State if there are cancellations. So that helps them get in sooner. But people are really struggling to get appointments to renew their driver's licenses and things like that. In some situations, it's been taking them months to be able to get in. Hopefully with things opening up, that will, ease up a little bit for folks, but it has been a challenge. And the carriers, I think the insurance carriers have been trying to accommodate that and provide some flexibility for people.
Well, and let's hope as well, if maybe they are pulled over, some of the law enforcement members are also recognizing some of these issues, because I do believe the Secretary of State's office has said that the appointments that they have gone to through COVID are going to stick around post-COVID as well. But we all know trying to get some of those appointments can be difficult. And if you can't clear up your driving record, it impacts your insurance rates, right?
Absolutely, it does. Absolutely, yes.
We're talking with
any kind of that does impact your rates.
I'm sorry, we're talking with Barb Sosin. She's with Farmers Insurance here in West Bloomfield, and you were talking, Barb, about the rates.
I was just reinforcing the fact that yes, any kind of tickets, any violations impacts your rates. So yeah, you want to make sure that you do have can clean up your driving record if there are any errors on it.
So Farmers Insurance, it's not just auto insurance, right?
Right. We insure homes and boats and ATVs and golf carts and business insurance and life insurance. All sorts of great stuff.
So what changes have you seen over the past year with the pandemic?
Well, I think that, one big thing is the pandemic has really hit our small businesses very hard. And, that was one of the big challenges I faced back, in March when when the state started to shut down. And my small business customers were calling me saying, oh, my income ended like that. Closed down. I have no income. I can't pay my insurance. And so I'm so proud to work with Farmers because they really made accommodations for our clients and said, listen, we're not going to cancel policies. We're not going to charge late fees. We're going to help people and especially the small businesses. And, we'll figure out payment plans down the line if we have to. And that was a game changer for small businesses who were just really struggling. And so we were able to make those accommodations. Other big thing was life insurance, right? People were losing family members, very healthy young people dying. And I think people people losing jobs. And I think it became a rude awakening for a lot of people that, if I lose my spouse, how will I be able to financially support my family in the future? And re-looking at life insurance. And, oftentimes customers will say, but I've got life insurance through my employer. And I view that as temporary insurance because if you are no longer employed with that employer, you no longer have life insurance. Once you retire, you no longer have life insurance. And then what do you do? So we've been having these conversations with customers, and I think people are starting to see the value. And a lot of Americans have realized when they lost their job, they don't necessarily have, money and savings to support themselves during tough times like this. So it was a real game changer for the life insurance industry, I think.
Wow. Yeah, it really takes some of these, a crisis for us to reevaluate our lives and have these conversations as well. We're joined on the show, Barb Sosin with us with Farmers Insurance. Just another minute or two before we say goodbye to you, Barbara. I noticed I was watching, I think it was Good Morning America the other day, and they were talking about how when people travel rental cars are really hard to get right now because of the pandemic. And so many of the rental car agencies had sold off their fleet back at the beginning of the pandemic. And now you can't find rental cars. So we're seeing some of these programs pop up. Like it's basically like an Airbnb, but for your car. Have you had anyone look into basically renting out their car? And if they're going to do that, should they have additional insurance?
Well, this is the first time actually even hearing of this. I would definitely recommend that people contact their insurance carrier or their insurance agent over this, because that is you're entering into very risky business there, and your typical insurance policy most likely will not cover your vehicle or you in the event that you are renting that out to another person. So there's going to have to be separate or different types of coverage in that situation. So don't just do that without consulting your insurance carrier first.
Right. There's so many ins and outs when it comes to the insurance company and your insurance policies. You really do need to take the time to understand it, especially if you're going to be doing something like that, where you're renting your car out to strangers. At the end of the day, you're ultimately responsible for that car. So with that, Barb Sosen with us here. She's with Farmers Insurance. Barb, maybe anything I didn't touch on that you want to add before we say goodbye?
No, I I appreciate the opportunity to be on here, and I just appreciate the community I'm in and how supportive my neighbors have been, and I'm excited to be part of this community and offered my services to the residents here in West Bloomfield and surrounding communities.
Well, it's been great having you with us here on the show. Barb Sosen with us. She's with Farmers Insurance, located in West Bloomfield. It really is important for you to look at your insurance policies, update them as your life circumstances change as well. Barb, again, thank you for being with us.
Thank you.
We're going to take a quick break here on the Megacast.
Right now, our country feels divided, but there's a place where people are coming together.
I was nervous to talk to someone so different than me.
Me too.
Love Has No Labels and One Small Step are helping people with different political views, beliefs, and experiences connect through conversation, and it feels good.
This conversation gives me hope.
It gives me a lot of hope, too.
Take a step toward bringing our country and your community together. Start a conversation at lovehasnolabels.com/onesmallstep. A message from StoryCorps, Love Has No Labels, and the Ad Council.
Over a decade ago, the journey to a COVID vaccine began. Building upon research on other coronaviruses, scientists continued with months of research and development, 3 phases of clinical trials with tens of thousands of diverse volunteers, then peer review and authorization to deliver a safe and effective vaccine that will protect all of us. Discover the facts for yourself at michigan.gov/COVID vaccine. Wearing a mask is more than protection. It's a bridge to better days. The path back to celebrations with family. Nights out on the town with friends. Game days with your favorite sports teams. And the thrill of live concerts. But until we can all get the COVID-19 vaccine and build community immunity, which will take time, we all need to continue to stay careful. Because Michigan's recovery is depending on you, and so are your family, friends, and neighbors. So even after you're vaccinated, wear a mask, avoid large gatherings, and social distance. One day in the near future, we will all be able to put this pandemic behind us. But until then, spread hope, not COVID. Learn more at michigan.gov/coronavirus. A message from the Michigan Department of Health and Human Services.
In times like these, we have to believe in each other.
And we believe that you'll do the right thing.
When it comes to stopping the spread of COVID.
Follow the 3 W's.
Wear a mask.
Wash your hands. Watch your distance.
And when it's your turn to get the vaccine, take your shot.
It all comes down to the golden rule.
Treat others the way you want to be treated.
We're so close, Michigan.
We can do this together.
want to say thank you for taking time out of your day to be with us on the Megacast. I'm Ronnie Dahl here in my home studios. Just a few minutes here left in the show. And at the top of the show, we were joined Governor Gretchen Whitmer holding a press conference with an update on where the state stands currently and the COVID-19 crisis. The good news in all of this, Tyler, things are improving greatly here in the state of Michigan compared to where we were just a month ago.
Yeah,
we were in, the surge and the numbers were really, quite frankly, very scary. But we're down, our case count is down 60% right now from April.
Yeah, it's really a drastic drop from where it was at this point a month ago, where hospital systems were taking extreme precautions, many of them limiting or restricting visitor hours, some even eliminating non-essential procedures and checkups on site or moving those to auxiliary facilities or tent facilities outside of their main hospital buildings. Really, we're in a very tight spot here in the state of Michigan, and with those cases dropping dramatically, we've also seen that the kind of a lull that we had in vaccines here in Michigan is starting to inch back upwards and trend in the right direction. And as we talked about earlier also, the allowance for primary care providers to begin to register with the state to provide vaccines to their patients straight out of their offices is something that I also believe will be beneficial to continuing to get people in the state of Michigan vaccinated, especially now as we're quickly approaching, sometime in the next 24 hours, maybe even, the CDC granting allowance for 12 to 15-year-old individuals to be vaccinated with the Pfizer vaccine.
Well, and we do know the governor said they are prepared to be able to vaccinate as many kids as want it here in the state of Michigan. It's anticipated there are about 500,000 kids here in Michigan that fall within that age group. However, we are seeing the hesitancy right now. The ones that wanted the vaccine, I think they really have already had it. We remember the long lines, how hard it was to try to find a vaccine. Just a few short months ago, it was very difficult. That's not the case right now. The supply is really, the demand isn't there any longer. And you also wonder, too, what does that mean for some of these vaccines that are on the shelf? Because we do have to remember a lot of them have a shelf life. Are we going to see vaccines right now go to waste because people don't want them?
Yeah, and I think the big question in terms of vaccine hesitancy is, as we see numbers of people getting vaccinated continue to creep upward, in small numbers, but still looking positively into the future, where does that hit that final lull and that plateau, and does that put us in a point where we have a delayed reaching of that 70% threshold? We've had predictions after predictions over the last several months, and different circumstances have halted that progress forward. But the biggest thing right now, the biggest obstacle for the state and for the country to overcome is that vaccine hesitancy. And we talk about those two categories. The people that are kind of apprehensive, are waiting to see how things pan out, are waiting to see how some other people in their lives react to their vaccinations. And then you have others that are simply never going to get the vaccine under any circumstances. We can, in this case with the vaccine hesitancy, disregard that group, and that first group that is still on the fence, that is still waiting, encourage them to speak to medical professionals in their life and get their questions answered. Lead them to resources that they can do their own research and their own background from reliable sources on these vaccines. And much like Dr. Taweel said earlier, not shaming these people that are hesitant, but otherwise helping them along the way and guiding them to information so that they can make an informed choice.
And with that, the governor also acknowledging that she does anticipate reaching that next benchmark of 60% is going to be a little bit more difficult, and trying to get the state there so that we can loosen up some more of the restrictions. We'll see how long it takes us to get there. Oakland County is already there. However, it's the state number that counts. And what's going to be interesting, too, going forward is if we don't reach these benchmarks, what is the governor going to do?
Yeah, I think that's a big question for most people in the state and really countrywide is there is still a scenario where we don't reach those numbers. And you have to think about if that is the case, what does our future look like going through this pandemic if those numbers at some point are decided to be inattainable? Right now, the biggest thing is still getting over that vaccine hesitancy hump as much as possible and getting through that obstacle and trying to continue to inch our way forward so that, if nothing else, we get as many people vaccinated against COVID-19 as is possible.
But so we do know that one thing that is going to be happening, it's anticipated on the 24th of May, that office workers will be allowed to return back to the office because of that 55% benchmark. We need 60% for some of the restrictions and capacity limits to be eased. So the good thing, people are going back to the offices. That is going to impact a lot of the surrounding businesses, but still quite clear that we are still in the middle of this pandemic. And of course, we'll continue to watch it here at Civic Center TV and on the Megacast and continue to bring you all these important conversations and interviews as we continue to try to navigate COVID-19 and the crisis. I can't wait to the day, Tyler, I don't have to say COVID-19.
Yeah, so do I. I'd like to get this out of our lexicon as quick as possible.
Well, with that, that's going to wrap it up for today's episode. We want to say thank you for being with us. Have a happy Wednesday.